But testing is a real challenge for many Ohioans, especially those who fear they've been exposed but don't have any symptoms. Statehouse correspondent Andy Chow looked into the problems in getting a COVID test when it's needed and getting back the results in time.
There's a backlog at their labs, 7 to 10 day backlog.
Andrea Eastman lives in Grandview, just west of Columbus, where she's been caring for her 2 grandsons during the pandemic. Recently, Eastman experienced a number of obstacles trying to get tested for COVID-19 after finding out her husband and daughter came into contact with someone at work who tested positive. After running into some roadblocks, she tried getting a test at a local pharmacy, which required her to fill out a questionnaire.
And so I answered all the questions and it said, sorry, you're not eligible. And I thought, okay, what do I do now?
Eastman's story has been common throughout the state. People who are concerned after coming into contact with COVID-19 but find trouble getting tested. Many people are able to get tested at their local health department, like here at Columbus Public Health. Its commissioner, Dr. Mashika Roberts, says for people who have come into contact with someone who has COVID-19, the best course of action is to quarantine.
Now, if you're asymptomatic and you're quarantined because you've been exposed and you can't get tested or you're waiting for results, we also encourage you to, hunker down, stay home, avoid those social gatherings, avoid non-essential trips to wait for the 14 days to play out.
Roberts acknowledges the issues people are having with access to testing, pointing out that supplies are now being redirected to other states seeing an outbreak of the virus. But Roberts adds that the term exposure comes with a specific definition.
We work with a business when we identify a case that has been at work and it goes to people. We interview the case, the person who's infected, and we ask them, who were you exposed to? And I want to make sure that the public understands what exposure is. So exposure is you're within 6 feet of someone for more than 10 to 15 minutes. That's exposure. So just working in an office building with someone doesn't mean you've been exposed.
Governor Mike DeWine has said identifying people who came into contact with the virus, getting them tested, and doing contact tracing all play a vital role in stopping the spread of the virus so businesses can reopen and stay open. At the beginning of June, the state was hovering around an average of about 10,000 tests a day. In the last 2 weeks, the state is averaging nearly 24,000 tests a day. DeWine says the state lab takes 24 to 36 hours to turn around test results. A regional director for CVS says the labs they work with can take up to 7 days to turn around those test results, a delay that can hamper the effectiveness of contact tracing. DeWine says he hears about the challenges when it comes to access to testing.
Look, we have to continue to improve this.
And DeWine says the state needs to, once again, double the testing capacity.
So we're going to continue to do everything that we can to drive those numbers up because we know that the more testing we do, the more tracing we can do, the more we're going to identify people who have the COVID who do not know they have the COVID, so that they will be informed so that they cannot infect other people.
The state's website notes retailers are doing testing, but there are conditions to get tests that the state says are decided by those businesses. Community health centers and departments of health are operating testing sites, and pop-up sites have been happening around the state. Eastman says she kept running into a wall when she tried to get tested, and without knowing if she had been exposed or not, brought big questions. Could she still watch her grandkids? Should she avoid riding the elevator in her apartment complex?
It's difficult because the ripples don't just affect my bubble. It starts going out to everybody.
DeWine says he brought up Ohio's challenges with testing during a meeting with Dr. Deborah Birx, the White House Coronavirus Task Force coordinator. He says he's working with federal officials to possibly come up with new ways to ramp up capacity. Andy Chow, Statehouse News Bureau.